Welcome to my Leadership Artifact 3 presentation. My name is Audra Kessler, and I'm a doc student at Penn West University in the Health Science and Exercise Leadership program. My presentation is on caring for patients experiencing homelessness, clinical considerations, and the role of street medicine. My research foci for this presentation focuses on incorporating culturally responsive and inclusive care into the medical curricula. As rates of homelessness continue to rise nationwide, healthcare providers are increasingly called upon to address the unique medical, social, and behavioral healthcare needs of this vulnerable population. My leadership team consisted of Shelley, a physician assistant faculty member, Dr. Carty, a street medicine team leader, the student organization SAPA, Haley, the president of SAPA, and two homeless shelters local to Slippery Rock University. My team members contributed to this artifact through the educational session event planning, clinical expertise in the area of homelessness, and frontline experience on the street medicine team. In collaboration with the student organization SAPA, we also contributed to local community resources through a service initiative, which helped to promote student engagement. The session focused on individuals experiencing homelessness, a population selected due to the growing prevalence of homelessness both nationally and within the Pittsburgh region. According to the 2024 Housing and Urban Development Report, homelessness increased 18% from 2023 to 2024 in the United States. Pittsburgh serves as a primary healthcare market for many of our Slippery Rock University graduates. Recent data indicates a 66% increase in homelessness over the past 3 years, underscoring the importance of preparing these future healthcare providers to address the unique challenges and barriers faced by this patient population. The speaker for this educational session was Dr. Alexandra Carty. She is a doctor of osteopathic medicine and a member of the street medicine team in Pittsburgh within the Allegheny Health Network. She was selected based on her extensive expertise and frontline experience working with homeless patients. She brought both clinical relevance and community perspective to the session. The presentation provided a comprehensive overview of homelessness. She discussed risk factors and healthcare challenges faced by these individuals. She also shared examples of real-life patients that she encountered throughout her practice. Dr. Carty also discussed current guidelines and research related to these patients and healthcare management along with street medicine. Although street medicine is now widely practiced across the country, its concept began in the early 1990s in Pittsburgh. Dr. Jim Withers began bringing medical care directly to unhoused individuals in their own environment. This movement led to the foundation of the Operation Safety Net, which was founded in 1992. A core value of street medicine is go to the people. Street medicine is effective only when we meet people in their own terms, in their own spaces. So that is what street medicine does. Healthcare providers go to the homeless, in tents, under bridges, wherever they call home, to provide them the medical care that they need. Dr. Carty explained that street medicine is a multidisciplinary approach that includes physicians, nurses, community health workers, and social workers. Homeless patients have access to multiple services such as general medicine, addiction care, housing, benefits, and social services. These patients can also be seen in many different medical settings. This educational session was evaluated by the students through scanning a QR code that was linked to a Qualtrics survey. Feedback was overwhelmingly positive. 100% of students agreed that the street medicine presentation increased their understanding of the unique healthcare challenges faced by individuals experiencing homelessness. Although I considered presenting this educational session to a new cohort of students during the summer semester, I ultimately decided against this approach in order to preserve the continuity across all three leadership artifacts. From the beginning, my vision was to develop an educational series that addressed multiple vulnerable patient populations while maintaining a consistent audience throughout the experience. Because this was the final session, students were also asked to evaluate the leadership series as a whole. All students agreed that the series helped them become more confident in providing compassionate, patient-centered care to vulnerable and underserved populations. This consistent structure and audience has allowed students to build upon prior sessions and develop a more comprehensive understanding of healthcare disparities and advocacy. In addition to the presentation, I collaborated with SAPA to create an opportunity for broader student participation through community engagement. This decision allowed students to move beyond passive learning and actively support vulnerable populations within their community. The two shelters that we supported were City Mission and City Rescue Mission. We collected coffee and canned goods for one and over-the-counter medications and body care for the other. This artifact supports my vision of empowering future healthcare professionals to care for vulnerable populations by increasing physician assistant students' understanding of the unique healthcare needs and barriers faced by individuals experiencing homelessness. It aligns with my mission by integrating evidence based education, clinical expertise from a street medicine provider, and community engagement through service initiatives that directly benefit individuals experiencing homelessness. This artifact reflects my core values of curiosity and kindness while reinforcing my guiding principles of cultural competence, lifelong learning, and compassion and care by encouraging students to explore the social determinants of health, challenge assumptions and biases, and develop a deeper understanding of the complex factors that influence health outcomes. Moving forward, this experience helped shape my leadership by strengthening my ability to align educational initiatives with emerging community health needs. It helped reinforce the importance of addressing bias and stigma when educating future healthcare providers about vulnerable populations, and it also improved my communication and leadership skills by demonstrating the value of creating educational experiences. Thank you for taking the time to view my presentation, Caring for Patients Experiencing Homelessness, Clinical Considerations and the Role of Street Medicine. Listed below are the references I used when creating this presentation. AI and Grammarly were also used to support proofreading and editorial refinement, including grammar, clarity, readability, and professional tone. All ideas, content, and conclusions are the author's own.